Hello everyone, and thank you for joining us for our fourth episode and presentation of the Mini Psychology School by the research program Context, the collaborative network for training and excellence in psychotraumatology. My name is Ida Haahr-Pedersen. I'm a doctoral researcher and research fellow in the Context program, and I'm based at Trinity College Dublin. This presentation will focus on childhood trauma and more specifically on cross-sectional approaches to childhood trauma or childhood maltreatment, using the Danish Children Centres as a case study. The presentation is entitled One House, Multiple Helpers, a cross-sectional approach to child abuse at the Danish Children Centres. The Danish Children Centres is one of the partner organizations in Context working with or in relation to traumatized populations. First, I will briefly go through some of the international estimates on child maltreatment, also defined as child abuse and neglect of minors by the World Health Organization. Then I will briefly touch upon the Nordic context and the Nordic Barnehus or children center models, because the children center is actually not a Danish invention. Following this, I will talk about the background of the Danish children centers, their key tasks and services, and how they provide a cross-sectional approach to child abuse. Finally, I will discuss a concept from the child maltreatment or child victimization literature, the term poly-victimization. And I will discuss this term within the context of the Danish Children Centres. Child maltreatment is a global issue and a complicated concept to study and estimate due to different definitions of the term across different cultural settings, as well as different operationalizations presented in the research literature. The World Health Organization suggests that globally 1 in 5 women and 1 in 13 men report having been exposed to some sort of sexual abuse as children. Furthermore, the organization suggests that a quarter of all adults report having been exposed to physical violence as children. Various negative effects of child maltreatment on both child and adult health are well documented in the research literature. Child maltreatment has shown to negatively impact both mental and physical health, and has been associated with both behavioral and interpersonal problems, as well as adverse social and economic outcomes, and can thereby affect both individuals and societies. Before I'm moving on to talk about the Danish Children Centres as a cross-sectional approach to child abuse, I will present the story of Sophie. I will do this to illustrate a child's meeting with the system in cases of child maltreatment. Sophie is 12 years old and is living with her mother and her older brother. She absolutely loves horses and math, and she hates to get up early in the morning. Sophie's brother is a lot older than her, and very often at night, their cousins come over to visit the big brother. Some months ago, one of the older cousins started coming into Sophie's room at night. He started to expose himself in a sexual way. And after that, he asked Sophie to do the same thing. The visit got more and more frequent, and they got worse and worse. The cousin told Sophie not to tell anyone. and that it was their little secret. Sophie is now afraid every night the cousin comes over, but she can't tell her mom. She's so embarrassed, and she's afraid of the mother's reaction if she tells. Sophie is tired and sad at school. Sophie's teacher Lisa notices, and one day she asks Sophie if something is wrong. At first, Sophie doesn't want to tell, but then she talks to Lisa and tells her about the cousin. Lisa then reports the case to the local municipality. After the teacher Lisa has notified the local municipality, Sophie has to talk to various different professionals working with cases of child abuse. She's going to talk to a municipality social worker. She's also going to talk to the police. She's going to see a doctor and also a lawyer. And every time Sophie goes to a new institution, she has to tell the same story over and over again. In the end, it's really difficult for her to remember all the details, and she gets sad when thinking about it. She's also very afraid that she might need to meet her cousin in court. And every time she's going to meet a new professional, she has to lie to her friends about where she's going. But what if Sophie just had to go to one place, to enter one door, and then all the professionals could come and meet her in one place? What if she could tell her story just one time? And what if her story could get video recorded so she didn't have to think about meeting her cousin in court? This is what the Danish Children Centres are aiming at. Denmark, however, was not the first country with a child-focused and cross-sectional approach to child abuse. And the foundation of the Danish Children Centres is part of a bigger Nordic effort and movement. Iceland was the first Nordic country to establish a house for children, or barnahus, in the late 90s. A range of factors played an important role in the foundation of the Icelandic barnahus. The establishment of the centralized organ, the Government Agency for Child Protection, in the mid-90s, and an increased attentiveness and focus on child sexual abuse in Iceland following the First World Congress on Commercial Sexual Exploitation of Children held in Stockholm in 1996, along with the outcomes of the first study on the prevalence on child sexual abuse in Iceland, which resulted in a public demand for improved strategies for handling child sexual abuse. The Icelandic barnahus, however, was inspired by an existing US model developed as a response to child sexual abuse, the Child Advocacy Center model, established in Huntsville, Alabama in 1985. The US Child Advocacy Center model and the Barnahus model differ in certain ways, especially in relation to the role of the state and institutional affiliation. But both models center on the idea that child sexual abuse is a complex phenomenon which can be handled within a monosectoral framework but requires multiple sectoral responses and cross-disciplinary efforts. The aim of the Nordic Barnahus model is to meet children's need by offering multiple services under one roof and in child-friendly premises. Johansson and colleagues, who have done an extensive work on describing the development of the Nordic Barnehus models, describe the core components of the model as multi-professional approach and interagency collaboration, the one-door principle, that the child only has to go to one place, a child-friendly environment, avoiding secondary traumatization by reporting the same story over and over again in different institutional and sectoral settings, and a safe place for disclosure and a neutral place for professional interventions. Barnehus-inspired models have been established in other Nordic countries: Sweden, Norway, Finland, Greenland, the Faroe Islands, and the Åland Islands. The national variants differ in terms of their target groups and focus areas, that is, the types of abuse and violence targeted. They also differ in the way they're organized and in the ways they are affiliated with different authorities or agencies. The Danish and Icelandic model both handle cases of child sexual abuse and physical violence, but the target group in Iceland are children and adolescents up until the age of 15, whereas the target group in Denmark is a bit broader and includes youth up until the age of 18. Denmark is a small Nordic country with approximately 5.7 million inhabitants. The country is divided into 5 general regions with a total of 98 local municipalities with local authorities. These are distributed over the 5 regions. Each region has its own children centers, some of them with several localities to cover large geographical distances within the region. Denmark is characterized by a high level of decentralization, which means that the local authorities have high autonomy in terms of organizing and delivering social services. The local authorities are responsible to monitor the living conditions of children and youth belonging to the municipality and facilitate early intervention if needed. The objective is to ensure well-being for all children and guarantee equality regarding health and personal development. When the local authority suspects child abuse and the need of intervention, a comprehensive assessment, the paragraph 50 examination, will take place that consists of all the relevant aspects of the child's life, including the home and school environment. The aim of the assessment is also to identify potential individual and family difficulties as well as resources. If the conclusion of the assessment states that the child has special support needs, the local authority is obliged to initiate the relevant interventions. The paragraph 50 child examination is specifically relevant in relation to the Danish Children Centre concept in Denmark, since the Danish Children Centres assist the local authorities in conducting the assessment in cases of suspected or confirmed child abuse. But why were the Danish Children Centres established? The centers were established in 2013 as a part of the Danish legislation or reform, the assault package, or in Danish, overgrebspakken. The assault package was initiated after a series of severe cases of child abuse in Denmark. Those cases were critically reviewed by the National Board of Appeals, and the board concluded that the cases were characterized by a lack of overview and an absent or inappropriate cooperation between the different authorities and sectors involved. As a result of this review process, a list of recommendations and areas of concern were developed by a panel of experts. The overall aim of the assault package was to create a society where fewer children are exposed to violence and abuse, with an emphasis on early detection and intervention in relation to child mistreatment. One of the main aspects of the assault package was also to focus on preventive and interdisciplinary efforts. Since October 2013, as a part of the assault package, it has been mandatory for the Danish municipalities to use the Danish Children Centres in cases of known or suspected child abuse if the child is 0 to 17 years of age, the local municipality has decided to conduct or add to a child examination, the paragraph 50 examination in the Danish service law, or, and this is where the interdisciplinary or cross-sectional component comes in, at least one more additional sector than the municipality authority, or in Danish, the kommune, such as the police and or healthcare sector is involved in the case. Many different sectors may therefore be involved in a children's center case, spanning the local municipality, the police, the healthcare sector, sometimes forensic examiners depending on the case. And this means that many different professionals representing different fields of expertise and different professional logics, agendas, and understandings may operate within the children's center context. And one of the key tasks of the children's centers is to play out a coordinating role and to support and increase a cross-sectoral effort in cases of violence against children or child sexual abuse through cohesive and coordinated case procedures with a specific focus on the perspectives and the needs of the child. The following points have been forwarded as being essential in the process of providing a child-centered approach by one of the Danish Children Centres, the Centre for the Capital Region. Overall, it's important to create safety and clarity for the child. It's also important to ensure that the child's perspective is included in all considerations and decisions. How does the child understand what is happening? Who plays a role in relation to this? Is the child left with difficult thoughts and feelings? And to ensure that the child is informed about what is going to happen in the case and why. Furthermore, in each case, it is important to consider what would be sufficient and least interfering for the specific child in the specific case. In addition to the very important role of coordinating a cross-sectional approach to child abuse and to make sure that all the different relevant professionals are gathering in the Children's Center, the Children's Centers also offer a range of services for professionals working within the field of child abuse, but also to families and children. The Danish Children Centres offer consultations to municipality social workers in cases or issues related to violence and sexual abuse of children. The aims of these phone consultations are to support and qualify the assessment of whether the municipality should report the case or not. In these consultations, the aspect of interdisciplinarity or cross-sectional approaches are also discussed, since a part of the consultation could be a discussion about whether the police and or the medical sector should be involved in the case and to discuss how the case should further proceed. One of the core components of the Children's Center work are sessions for children and parents. In the Danish Children's Center for the Capital Region, these sessions are carried out by teams of psychologists and social workers. Different methods and techniques, for example, play therapy or psychological screenings of the child, are applied in the child session. A screening could, for example, be the trauma symptom checklist for children. The focus in the child sessions could be the current level of functioning of the child, an assessment of any symptoms of traumatization or PTSD, and a focus on the child's coping strategies and understandings of what has happened. The focus of the caregiver sessions could be to clarify the level of safety of the child in the given life situation. A final report is created after the sessions, which entails a description of the sessions, the child's possible symptoms of stress, and an assessment of the child's need for further support. This final report will be used as a part of the paragraph 50 examination, and the outcome of this overall examination will determine whether the child and the family should receive support under the Danish service law, serviceloven in Danish. Another very important activity taking place in the Danish Children Centres are investigative interviews. These are carried out by the police in cases of known or suspected child abuse. And the idea again is that the child doesn't have to go to a police station, doesn't have to go to several institutions to tell the story, but that the police instead is meeting the child in the children's center. The interviews are carried out with children up until the age of 15 years, and the interviews take place in the children's center, which is a child-friendly setting. This way of interviewing is a part of a more general Nordic model, where the video recorded interview from the pre-trial investigation is accepted as evidence in court, which means that the child doesn't have to go to court to tell its story and potentially meet the perpetrator. The interview is carried out by a specially trained interviewer with specific knowledge about child development, the effects of trauma and stress on children. And the idea is to try to avoid complicated courtroom language, but instead using open questions, avoiding an atmosphere of cross-examination of the child. But it's also important to mention that the focus is also a balance of child-friendly justice to meet the needs of the child, while also getting complete information which can be used in court. Different professionals can then be present in a monitor room from where they can observe the interview, and then they can potentially ask questions to the child via the specially trained interviewer who is with the child in another room. If we briefly return to the case of Sophie for a while, we saw that various different professionals were involved in the case. And one of the key roles of the children's centers is, as mentioned, to coordinate the cross-sectional efforts. The children's centers also host different types of cross-sectional meetings where the different relevant professionals can meet and exchange information and knowledge about the case. At these meetings, the casework will be coordinated, as well as the roles and responsibilities of the different sectors. An objective of this meeting is to establish a positive and effective collaboration early on in the case process and to coordinate high-quality interdisciplinary and cross-sectional efforts for children and families. Ever since the establishment in 2013, the Danish Children Centres have conducted a data collection in relation to their work. The 5 Danish Children Centres continuously register data on the cases in the center. This can, for example, be the type of violence or sexual abuse, information about the perpetrator, information about the services that the child or the family receives in the center. The data contributes to a national documentation and monitoring of the work conducted by the centers. And the national data collection is controlled by the National Board for Social Services. Every year, the board publishes a yearly statistics report with key statistics, for example, the number of cases. The following slides will present a few selected key statistics and case characteristics of the Danish Children Center cases. The numbers are extracted from the yearly Danish Children Center statistics report conducted and presented by the National Board for Social Services. The original figures have been translated. This figure is from the yearly statistics report from 2017, and it shows the number of children center cases per year from 2014 to 2017 at the national level. The figure shows that from 2014 to 2017, the number of yearly children center cases, and these are the cases where the child is actually assessed in the children's center, increased from 882 to 1,665, which is an increase of 89%. An increase has also happened in the other years. From 2014 to 2015, the increase was 26%. From 2015 to 2016, the increase was 19%. And from 2016 to 2017, the increase was 26%. On the basis of this data, it is, however, not possible to determine whether these increases are due to the fact that the municipalities have become better at tracing and identifying children exposed to abuse, whether it is due to an increased awareness of the municipalities in regard to the children's centers and their existence, or if the increase is due to other conditions. This figure demonstrates the gender distribution from the children's center cases in 2017, and this is again at the national level. 54% of the cases in 2017 concerned girls, and 46% of the cases concerned boys. In a few slides, I will present some more statistics from the Danish Children Centres, and more specifically on the forms of abuse, for example, how many children have been exposed to physical violence. But before I do this, I just want to briefly return to the case or the story of Sophie, and I'll do this to illustrate an important area of concern for the Danish Children Centres, but actually also for other organizations or institutions working with child abuse or child maltreatment. And we saw in the Sophie case that she had been exposed to sexual abuse by her older cousin. But maybe this was not the only type of abuse or maltreatment that Sophie had suffered. Maybe in addition to the sexual abuse, she had been emotionally abused by the partner of her mother. Maybe she had also been exposed to sexting, that is, receiving sexual text messages, maybe from a friend of the older cousin. And it might also be that in addition to this, she had experienced being bullied at school. The recent statistics report from the National Board for Social Services shows that a significant number of children had been exposed to more than one type of abuse. 4% of the children who had been assessed in one of the children's centers in 2017 had suffered both sexual abuse and physical violence. And these statistics only cover sexual abuse and physical violence. However, there might also be children who, in addition to these forms of abuse, have suffered other types of victimization or other forms of mistreatment, for example, emotional abuse, neglect. And recent research has documented how children exposed to one type of abuse have often been exposed to additional types of victimizations or adversities. And furthermore, research suggests that certain types of child abuse tend to cluster and overlap. This multiplicity aspect of childhood victimization has been conceptualized as poly-victimization in the research literature. Poly-victimization has been defined as the experience of multiple victimizations of different kinds by David Finkelhor and colleagues, who introduced the term in the research literature in 2005. In other studies, the authors have, however, conceptualized the term in more concrete terms as the experience of 4 or more different types of victimizations experienced by a child within the recent year. However, alternative definitions of the poly-victimization term have also been proposed in the research literature. And to date, there is no consensus on an exact numerical threshold for defining poly-victimization status among children and youth. How the term is defined is closely linked to the type of population within which the concept is studied, if it's a high-risk sample or a community sample, and also time frame seems to be an important factor, whether the concept is studied in the lifetime of the child or within the recent year. It's also important to mention that the multiplicity aspect of childhood victimization has been studied under related constructs such as multi-type maltreatment, cumulative trauma, polytraumatization. Despite these different definitions, conceptualizations, different numerical thresholds proposed to define polyvictimization status, there seems to be a consensus about that polyvictimization seems to be particularly harmful to child and adolescent mental health and seem to compromise mental health more than individual types of child victimizations or abuse. Polyvictimization has been linked to a range of adverse short and long-term health and behavioral outcomes, and suffering various victimizations across different life situations tends to compromise mental health more than being exposed to chronic victimization, for example, repeated sexual abuse by one perpetrator, since higher symptom scores and the most adverse outcomes have been identified among groups of polyvictims compared to other victim groups. A recent systematic review on the evidence on child abuse and neglect patterns of co-occurrence found that polyvictimization was associated with the most critical consequences in terms of both internalizing and externalizing symptomatology, such as depression, anxiety, aggression, and violent offending. Another systematic review, reviewing the evidence on the associations between polyvictimization and mental health outcomes and risk behaviors in low and lower middle income settings, concluded that polyvictimization was strongly associated with increased risk of emotional, behavioral, developmental, and internalizing problems in children and youth. Since multiple victimization exposures have often shown to be the norm rather than the exception among victimized children, a great amount of the research literature on child abuse emphasizes the importance of addressing and accounting for the full victimization history of maltreated individuals. Understanding and addressing the complex burden of victimization exposures is, however, not only important in research, but also in relation to prevention and treatment approaches. That is, to early identify and intervene in relation to the children most at risk. Moreover, the concept of poly-victimization calls into question the planning and organization of prevention, intervention, and treatment programs, which are often arranged around distinct types of victimization, for example, bullying or sexual abuse. Poly-victimization is therefore also a highly relevant concept to discuss in relation to multidisciplinary and cross-sectional case management. And this is why it's also an important concept to discuss and investigate within the Children's Center context or Barnahus context. To date, the main focus in the Children's Center work has been to assess and to register incidents of sexual abuse and physical violence, because these are the main crimes listed in the whole Children's Center Foundation and Children's Center framework. But in the future, there will be an increased focus on also assessing and investigating other types of maltreatment and abuse among the children assessed in the center to get a more complete picture of their victimization burden, which can then help to inform and guide intervention and treatment planning. So, since poly-victimization or these multiple victimization experiences are not uncommon among victimized children, poly-victimization is a very relevant concept to investigate and to have focus on, to discuss in institutions working with child abuse, working with victimized children. And this is the case in Denmark, but also in the other Nordic countries, as well as more globally for different kind of organizations or institutions working with child abuse or child maltreatment. Thank you very much for watching and listening to this presentation as a part of the Context Mini Psychology School. In addition to this mini psychology school presentation, there is a case study with more information about the Danish Children Center cross-sectional approaches to child abuse in the Nordic countries, as well as definitions of sexual abuse, physical violence, the impacts of child abuse, as well as more information about the concept of poly-victimization. In this case study, you can also find the references for this mini psychology school presentation. I would also like to thank the European Union for the funding for this project. If you have any questions, please get in touch. You can also visit our website, psychotraumanetwork.com, where you can read more about the Context program.